This is the next part of our series on basis of veterinary dentistry, and in this video we are going to talk about some species specific differences that occur in different species. So the first one we have is in horses. We have wolf teeth in horses, and what are wolf teeth? Basically, these are first premolars in the upper dental arcade of 20 to 60% of horses. So this means that in the premolars, that is, we have premolars like premolar 1, premolar 2, premolar 3, and premolar 4. So the premolar 1 is called as wolf teeth in horses, like you can see. And these teeth are very small, and these are called as vestigial teeth because they do not have as such any important function in the equine dentistry. So all you have to remember is wolf teeth are present in horses, and these are the first upper premolars that appear in 20 to 60% of horses only. Next we have is needle teeth. Needle teeth are they appear in piglets, and these are deciduous third incisors and canines that are sometimes removed after birth. So basically in piglets we have third incisor and deciduous canine teeth that are together called as needle teeth. In the upper dental arcade and in the lower dental arcade, both we have these teeth. Whereas we have seen wolf teeth only appear in the upper dental arcade, not in the lower one. But needle teeth, they appear in upper and lower both dental arcade, and they are being removed normally after birth. And you should remember that these are deciduous teeth, whereas wolf teeth are permanent teeth. Next, we have is fighting teeth. Fighting teeth are basically species-specific difference in llama and alpaca. These are upper third incisor and upper and lower canine present in llamas and alpacas. You can see over here that in the upper dental arcade, we have the third incisor and first canine. Whereas in the lower dental arcade, we have only canine. These three teeth are called as fighting teeth because llama and alpaca, when they fight, they use these teeth to bite and grasp their opponent, and they are very sharp, as you can see the pointed ends of these teeth. They grow over 3 centimeter, and they should be removed after eruption at 18 to 24 months. Next we have is carcinal teeth. Carcinal teeth appear in dogs, and these are upper fourth premolar and lower first molar teeth in dogs. So you can see the upper fourth premolar and lower first molar teeth. Basically, these teeth, upper and lower teeth, are paired in such a way that they allow enlarged and often self-shearing edges to pass each other in shearing manner. So it basically allows the dog to uh, chew or shear the whatsoever object they are eating or biting easily. And these are the most commonly used tooth, so they are the most commonly abscessed tooth. More these or you can say as a clinician, when you will encounter the tooth abscess issues in the dogs, you will see that the most common tooth that are abscessed are the carcinal teeth. So I hope you understand these 4 species specific differences. That was all, and there is no as such conceptual thing in these 4 things. All you have to remember is what teeth are included in all these, like fighting, carcinal, needle teeth, like which either canines, premolars, molars, which teeth are making these teeth. So that was all about this video. Stay tuned and don't forget to subscribe the YouTube channel. Thank you so much.